Welcome to CNTV. We're glad you're with us. I'm Brad Clonch.
And I'm Quin Tran. Videos are streaming now for the Chickasaw Nation's annual meeting and festival. A virtual gathering of our people is a week-long celebration leading up to the Chickasaw Nation's 60th annual meeting, featuring Governor Bill Anatubby's State of the Nation address. Hear from Governor Anatubby on Saturday, October 3rd at 9 a.m. Due to the pandemic and for the safety of Chickasaw citizens and communities, events and activities are all online. From September 26th through October 3rd, see a variety of presentations and tour videos. Meet Chickasaws and learn about programs and services. Go to the web address on your screen and enjoy viewing from your computer, smartphone, or any streaming device.
This is footage of last year's CSAM, the Southeastern Art Show and Market, a popular event during Festival Week. CSAM is also virtual this year to showcase the works of Native artists, both adults and youth. The online art market runs October 2nd through the end of the year.
In other festival news, the 3 Chickasaw princesses crowned last year will continue to serve this new term. The tribe is proud to have Chickasaw Princess Marquita McCarty, Chickasaw Junior Princess Brinley Underwood, and Little Miss Chickasaw Kinsey Carter to serve as ambassadors. Visit the tribe's annual meeting web address or Facebook page to view a Princess Pageant highlight video.
Looking at other news, Chickasaw health officials say mitigation efforts need to continue to prevent another surge of COVID-19 infections.
We spoke a few days ago with a Chickasaw Nation doctor who's on the front lines taking care of COVID-19 patients.
From day to day, we don't know if we're going to have a full ICU, if we're just going to have 1 or 2. The stress is in not knowing for sure if a patient is going to get better or not. And many other conditions we can predict based on risk factors if someone's going to get better or if they're likely to not do well. There's no playbook for that with COVID. It's all very person to person. We don't know what causes people to get worse, but we just do the best that we can with supporting them, whether that means having them on a ventilator or just oxygen support, along with the other things I mentioned, convalescent plasma, remdesivir, steroids, things like that. So it's stressful with the not knowing and not being able to be as clear of a guide as we like to be when it comes to prognosis.
Doctor, you're a Native American Indian physician. How has this experience changed you as a Native person and also as a physician?
As Natives, we are very close with our families and we're able to be with our families when they go to the hospital. When my mom was in the hospital recently, well, not recently, pre-pandemic, they kind of laughed because the whole tribe was there to support her. And that's not able to happen because of the restrictions to try to limit the spread of COVID-19. And it's a much different dynamic when a patient is here alone. We try to make that a little bit better by, we have some video conferencing options. We have, we'll put their families on speakerphone if they want us to. Some families have come up with signs and lawn chairs and parked outside and held their signs up for their loved ones. And so that's one of the biggest things that I think, especially for Native culture, that is a huge adjustment to this pandemic. I feel extremely connected to my patients, especially being culturally very similar. So I very much empathize and connect. And, when we have successes in our patients, we celebrate together. I celebrate as if it's my brother getting better, my dad getting better. And if we have a loss, it hits the heart hard. It's not a statistic. It's not another number. It's a true loss for the entire staff. And I will say the first patient that passed away from COVID that we had here, my husband had to console me because I was crying very hard. Luckily, we've had much more patients recover from COVID than pass away, but the ones that do, you can't forget them.
You lead a very dedicated team. What would you say about the team and the spirit of coming together and working to help patients?
Oh, everybody here at Chickasaw Nation has really impressed me with the teamwork that they have done to prepare for the pandemic and to manage the patients. You know, inevitably something's going to come up that we didn't think about, and we all get our heads together and come up with a solution. And, you know, I think that I'm really proud of Chickasaw Nation and what we've done here with the hospitalist team, the nursing staff, administration, ER, anesthesia. Everybody has done a really great job coming together, being optimistic, being, you know, problem-solving oriented, have just done a wonderful job, not just the science and the medicine side, but they are empathetic, they are caring, they go above and beyond for their patients. And it's just awesome to see that, probably more so here than anywhere I've ever worked.
What do you want our viewers to know about COVID-19 at this point?
Wash your hands, wash your hands, wash your hands, wear a mask. You know, no big groups. We can really put a muzzle on this thing and slow it down.
Dr. Burden-Greer also adds to avoid large gatherings, continue with responsible distancing.
Get the latest health information at chickasaw.net. We want to mention that flu vaccine clinics are scheduled on different dates and locations throughout the Chickasaw Nation, including at senior sites this month. Over the past several weeks, we've been spotlighting the citizens named in this year's Chickasaw Hall of Fame. We conclude our feature with a look at the service and contributions of retired Rear Admiral Kevin Meeks.
Retired Rear Admiral Kevin Meeks was born in 1958 and raised in Bing. He earned a bachelor's degree from East Central University, as well as a master's degree in public health from the University of Oklahoma. Beginning a career with Indian Health Services in 1987 in South Dakota, Meeks later relocated to Alaska.
I would say that he would try to do everything that he could to allow the people to get the mission of our organization, the health care, the delivery of public health services, of water and sewer services. He did whatever he could to try to get rid of barriers, break down barriers, rules and regulations, so that we could really take care of the people that we needed to take care of for whatever program that was.
Admiral Meeks was promoted to Oklahoma City Area Director in 2009, serving until 2017, being given the responsibility of providing comprehensive health care services to one of the largest and most diverse service populations in IHS.
Admiral Meeks' influence on Indian health and the IHS was nationwide. The work that he did and the impact that he had helped all American Indians throughout the nation. Admiral Meeks never let a position or boundaries hold him back whenever he knew that work needed to be done. He was a fierce advocate for the health care for the beneficiaries that we serve.
He's had roles at the regional level here in Oklahoma and also at the national level that has left an impact from a health standpoint on people all over the country. He's a proud Chickasaw citizen, and he's led a very impactful life for the health of our people.
We'll share more in the coming months. A recent conversation with Admiral Meeks about his career in Indian Health Services.
We thank him for his service and thank you for joining us today. We'll see you next time for another episode of CNTV with highlights of the Chickasaw Nation's annual meeting and festival.